Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients. I am Marcy Lawing, the TriageLogic nurse educator. Now that you and I have done a call scenario together and successfully gotten baby Laura to the correct level of care using our 10 critical steps of a triage call, let's have you try one on your own. Let's do a quick review of the 10 critical steps of a triage call. Step 1. Introduce yourself. Step 2. Collect demographic information. Step 3. Collect a brief past medical history. Step 4. Let your patient talk. Step 5. Document a brief yet complete assessment. Step 6. Choose your protocol. Step 7. Get your patient to the right level of care. Step 8. Give all relevant care advice. Step 9. Make sure your patient knows when to call back. And Step 10. Offer reassurance and be sure your patient is able and willing to follow the plan you discussed. Are you ready to meet your patient? Step 1. Introduce yourself. This may seem awkward to do this part without a patient on the phone, but you should practice your introduction out loud. Be mindful of your tone, speed, and quality of your voice. You should sound confident and be sure to speak slowly and clearly so that your patient can understand you. You verify that although your patient is ill, he is stable enough for you to collect more information about the reason for the call today. It is actually his daughter Maria that is calling you this Saturday afternoon. You verify that your patient's name is Juan and he is 80 years old and is a patient of Dr. Gonzalez, although he has not seen him in about a year. Step 3. Next, let's find out about Juan's past medical history. Your nursing judgment and critical thinking skills forewarn you that because of his advanced age, you need to ask more questions and consider his chronic illnesses when deciding on the safest level of care for this patient. Write down some open-ended questions that you would ask Maria to get information about her father's past medical history. You could start with, "Tell me about your father's health conditions and what medication he takes on a daily basis." Or, "What is a typical day like for your father? What is his normal activity level?" Maria tells you that her father was diagnosed with type 2 diabetes about 10 years ago, and also is taking a medication for his high blood pressure. Her father was widowed 5 years ago and lives alone in the one-story home he shared with his wife for 45 years before she passed away. He is fairly active and is normally able to do his ADLs without assistance. He walks about 1 mile 3 times a week for exercise. Maria states her father seldom goes to the doctor. He has Medicare but no supplemental insurance and lives on a very strict budget. Step 4. Now that you know a little about Juan's past medical history, let Maria tell you why she's calling today. Again, an open-ended question is the best way to elicit this information from your caller. You might ask, "Tell me what prompted you to call the nurse triage this afternoon." Maria tells you that she came to check on her father and found him sitting in his favorite recliner with his eyes closed. She kissed him on the forehead like she normally does, but this time he didn't wake up. She gave him a gentle shake and called his name. He did respond to her, but he is much groggier than she has ever seen him. Step 5. You ask again if Juan is stable enough for you to continue with your assessment, and Maria says yes. He is making eye contact, but he says he feels very tired. He was just able to walk to the bathroom by himself, but was very slow, and he held onto the walls at times because he felt a little lightheaded. Juan does have a blood pressure machine at home, so you ask Maria to get a set of vital signs. She discovers his temperature is 101 orally, His blood pressure is 90/40 with a heart rate of 107. She counts his respirations. They are at 10 per minute. And she checked his oxygen sats, 98% on room air. Maria sees a partially eaten sandwich on a plate next to her father and a nearly full bottle of water. Neither were there last night when she checked on him, so she thinks he must have eaten a little bit today. You ask Maria to be your eyes and collect more assessment information about her father's current condition. Following your directions, she tells you that his skin is warm, flushed appearing, and dry. She has him open his mouth and his tongue is dry also. His skin turgor is slow, and his eyes appear sunken slightly. You ask Maria to check her father's blood sugar level. The machine registers a number greater than 600. Based on the information you have collected so far, which protocol do you anticipate using to assess your patient's most acute symptom? If your instincts told you to use the diabetes protocol, you're right on track. With a glucose reading of over 600, this is more than likely causing many of Juan's symptoms. You should start thinking worst case scenario. You know that with a glucose reading that high, it can be indicative of diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS. You will want to rule these crises out before continuing. Write down what questions you would ask Maria next to be sure her father is not in DKA or HHS. Asking open-ended questions such as, "Tell me about your father's ability to answer simple questions, such as his name and birth date." This will let you know if he's alert and oriented. We know from Maria's earlier statement that her father can walk to the bathroom unassisted. Following up on that statement, you should ask, what was the outcome of your father's visit to the bathroom? Was he able to urinate? Determining if Juan is able to hold down food and fluids is also important. Diabetics that are vomiting and dehydrated could be heading towards DKA. Your nursing knowledge reminds you that DKA can occur in any diabetic, but it is most prevalent in young type 1 diabetics. The patient will exhibit a high blood sugar, be in a state of metabolic acidosis, and there is an increased concentration of ketones which can be detected in the patient's urine. You don't want to dismiss DKA as a possible diagnosis too quickly because you read the latest research and know that type 2 diabetics can develop DKA under conditions of extreme stress such as serious infection, trauma, cardiovascular, or other emergencies. Your patient Juan is febrile with a temperature of 101, but he is not having any chest pain or shortness of breath and has not suffered any major trauma recently. He is not vomiting and does not have a fruity odor to his breath. His breathing is slow but regular and unlabored. He is able to ambulate, but his gait is slower than normal. Your brain shifts to HHS, hyperosmolar hyperglycemic state. This is more common in type 2 diabetics. It is characterized by severe hyperglycemia, hyperosmolality, and dehydration. HHS is more common in elderly patients with type 2 diabetics and has a pretty high mortality rate, 19%, so you want to stay focused and gather the needed information to rule out a medical emergency. Let's move on to step 7, getting your patient to the right level of care. When your patient is in a hyperglycemic emergency, you must have the skill to recognize the symptoms immediately and act quickly to maximize the chances the patient will avoid serious complications. Based on Juan's current symptoms, Maria should not waste any time getting her father to the closest emergency room for treatment. Relevant care advice, which is step 8, in this case, is avoiding a delay in care. You ask Maria how far away the closest emergency room is. She answers that they are less than 10 minutes from the hospital and she can leave right now. You ask her to take her father's medications with them to the emergency room and to please leave now. With the urgency of this caller's symptoms, the care advice is very minimal. You do not want to waste time educating Maria about the causes of hyperglycemia or how to avoid them in the future. The main concern at this point is getting the proper treatment started as soon as possible. Step 9 is also important in this instance. Even though your patient is heading to the emergency room, there is a 10-minute window where he will be en route. You will want to be sure to inform Maria what symptoms to watch for that might indicate she needs to pull over and dial 911 for more assistance. Write down what symptoms you would want Maria to be aware of as she drives her father to the emergency room. Most importantly, you would want Maria to be aware that if her father lost consciousness or stopped breathing, that she should not drive faster or jeopardize her or her father's safety getting to the hospital. Rather, she should pull over and dial 911. While it seems counterproductive in wasting time, it can actually save his life if CPR is needed right away. Step 10 in this instance is very quick and very simple. You want to say out loud and in a clear, calm voice, "Are you able and willing to take your father to the nearest emergency room right now?" The caller's confirmation that she will comply with your recommendations is an essential part of your nursing encounter. Another job well done. Maria calls you later that evening and lets you know they made it to the emergency room safely, and her father was diagnosed with a urinary tract infection. He was admitted to the ICU unit where he will get the care he needs. The doctors told Maria they think he'll make a full recovery. Be sure to check back soon for another case scenario. We welcome you to leave comments and feedback about this course or any others you see on our Learning Center.